No, here. The one
Coronary
which
artery.
is from the base of the aorta. Which artery is this? Up to
Left
here.
coronary artery.
This is actually left coronary artery, but it has been divided into branches. And this is the right coronary
coronary
artery.
artery.
We have explained it so far. Left coronary artery. This is the left coronary artery, right? But left coronary artery has been divided into two branches. This one is the one which goes posteriorly. That is circumflex artery. Repeat everyone with me. And this one, the one which comes down.
Anterior
This is
descending.
the anterior descending artery. Very good. This anterior descending artery gives many more branches. This is the diagonal arteries, and these are the septal arteries. Septal arteries gives blood to what? Septum. And diagonal branches gives blood to what? Left ventricle, right? And circumflex arteries gives blood to what?
Posterior side of the
posterior side of the heart, specifically to the ventricle. And this circumflex artery has again many branches, and these branches are known as
oblique marginal
branches. Marginal means they give us the blood at the marginal side of the left ventricle. Clear? It was all about the left coronary artery. Clear up to here?
Yes.
Any doubt? Now let us try to understand about the right coronary artery. Which artery is this? Right coronary artery. See, so many branches are also here. See, are you able to see? Red one. These are also known as, here it was the marginal arteries because they were at the margin, right? So these are known as right marginal arteries. These are actually the branches of the right coronary artery, and they will give the blood to what? They will give the blood to what? They will give the blood to the right ventricle. Are you getting my point? This right coronary artery will give the blood to the base of the heart. This right coronary artery will give the blood to the base of the heart. Listen carefully. They will give the blood to the base of the heart, and these marginal arteries will give the blood to the right ventricle. Okay, are you getting my point? These marginal arteries will give the blood to the right ventricle, and this right coronary artery moves towards the back side. And again it has been divided here. See, are you able to see? Again it has been divided. So it comes down. So this is known as descending artery. But right or left? Left posterior descending artery. This artery is known as left posterior descending artery. And this left posterior descending artery will give the blood anterior to the right ventricle or posterior to the right ventricle?
Posterior to the
Yes.
right ventricle.
This very artery, posterior descending artery, which is actually the branch of the right coronary artery, will give blood to the right ventricle, but posteriorly. Are you getting my point? And marginal arteries will give blood to the margin of the right ventriculus. And if we talk about the right coronary artery, it will give blood to the base of the heart. It will give blood to the right ventricle. It will give blood to the it will give the blood to the ventricle posteriorly also, because it moves towards the back side. Are you getting my point? But posteriorly it gives the blood with the another branch which is arising from the right coronary artery, and that is the right descending coronary artery, right posteriorly descending artery. Are you getting my point? Yes. So this was about the coronary circulation. I will repeat. Right coronary artery once again. Right coronary artery is here, and it gives blood to the base of the heart. It gives blood to the right ventricle. It gives blood to the
Posterior.
back side of the heart also, but with the help of the right descending posterior artery. And anteriorly it gives with the help of the marginal artery. And posteriorly descending artery are the branches of the right coronary artery, which gives blood. Collectively they give blood to the base of the heart. Collectively they give blood to the base of the heart and the right ventricle, both anteriorly as well as the posteriorly. Posteriorly they give blood with the help of the right anterior descending coronary artery, and posteriorly, not anteriorly. And anteriorly they give blood with the help of the right descending marginal arteries. Are you getting my point?
Yes,
this
sir.
is the posterior descending artery, and this is the right marginal artery. Are you getting my point? So it was about the oxygenated blood, how the oxygenated blood gets received by the heart, how these arteries are giving the oxygenated blood to the heart. So it was all about the coronary circulation. But what about the What about the venous circulation? What about the venous circulation? You got it?
Yes.
समझ में आया? समझ में आया? डाउट है?
समझ में आया.
Okay, I will check. Which artery is this?
Right coronary artery.
Right coronary artery, and it moves towards backside, right? And which artery is this?
Posterior
Posterior descending coronary artery. Very good. Posterior descending artery gives blood to what?
The right ventricle.
Posterior right
Posteriorly.
ventricle side.
To the right ventricle, but posteriorly, right? And which arteries?
Marginal arteries.
Marginal arteries. It gives blood to what?
Apex of the
Not apex.
base of the heart. And
Base of the heart as well as to
right
the
ventricle.
right ventricle anteriorly, right? Okay. Which artery is this?
left coronary.
Left coronary artery, and it has been divided here. One is, which artery is this?
Left anterior
Left
descending.
anterior descending artery. Very good. Anterior descending artery, and which one is this?
Circumflex
artery. And circumflex artery again divided posteriorly.
Oblique margin.
Oblique marginal arteries, and oblique marginal arteries gives blood to what?
Left ventricle.
Left ventricle at the
Posterior.
margins, right? And what about these diagonal arteries? It gives blood to what?
Left ventricle
Yes. Left ventricle.
and side of
Right,
the
yes.
ventricle.
Side में, बिल्कुल. And what about these arteries?
Septal arteries and
It gives
diaphragm.
blood to the septal area of the heart. Clear? Clear?
Yes.
And this very grow is known as, which artery is running from here? Which artery is running from here?
Left coronary artery.
Coronary artery is running, right? So this grow is known as left coronary sulcus. Sulcus means depression. Okay, this is the left coronary sulcus, and this one is the right coronary sulcus. Clear?
Yes, sir.
So if someone will ask you, right coronary artery is running in which depression? What is the name of that depression? What
Right
will be your answer?
coronary sulcus.
Right coronary sulcus. One more depression. Are you able to find out one more depression is here on the heart? Here, between the ventricles. This depression is known as, it is between the ventricles, right? Interminus between. Interminus between the ventricles. So it is known as interventricular sulcus. Interventricular sulcus. What is the purpose of interventricular sulcus? It just separates the two ventricles. What is the purpose of these coronary sulcus? It just separates to what from what?
Atrium and ventricle.
Yes, it separates the atrium from the ventricles. Okay, it was some additional pointers about this. Now we will talk about the venous circulation. We will talk about the venous circulation. We will talk about the venous circulation. And veins are denoted by which color?
Blue.
Blue color. Okay. Which artery was this?
Anterior
Anterior descending artery. Parallelly, one more vein is running. Vein is running here in blue color. It is running along with the anterior descending artery. This vein is known as, listen carefully, the vein which is running in which groove is this? Interventricular groove, and running parallelly along with the anterior descending artery. This vein is known as great cardiac vein. This is known as great cardiac vein. It will collect the blood from the ventricle, and finally it will enter into the coronary sulcus, and through coronary sulcus, it will enter into the right atrium. It will enter into the right atrium. This is the coronary sulcus, and it will enter into the right atrium. Clear? Clear? Are you getting my point or not? Okay, so this is known as great cardiac vein, which collects the blood from the apex of the heart, from the left ventricle, enters into the coronary sulcus, and coronary sulcus will open into the right atrium. Clear? Clear or not? Yes. Okay. Okay. One more vein is there. See, this is known as posterior cardiac vein. This is known as posterior cardiac vein. It will collect the blood posteriorly, and it will also connect with the coronary sulcus, and it will again go into the right atrium. Are you getting my point? Are you getting my point? One more vein is here. See, it is at the middle. It is at the middle. See, one more vein is here. This is known as middle cardiac vein. This vein is known as middle cardiac vein. This vein is known as middle cardiac vein. It will collect the blood from the right ventricle and will enter into the coronary sulcus, and coronary sulcus will take this blood into the right atrium. Are you getting my point? Are you getting my point? So it was all about the coronary circulation and as well as the venous circulation. Are you getting my point? Are you getting my point?
Sure.
One more point I will add. One more point I will add, and after that I will repeat the entire lecture. One more point. When our body, listen carefully, when our body receives the oxygenated blood, when I will give you the two options. One is systolic period, during the systolic period, and another option is during the diastolic period.
During the
When
diastolic
oxygenated blood gets received by our body. In diastolic period or in systolic period?
diastolic period.
Diastolic.
In diastolic period. How many of you are with diastolic period?
Sir, systolic period.
Systolic period. How many of you are with systolic period?
Systolic. Systolic.
Shall I say something? It is interesting. Your lungs,
Diastolic.
your kidneys, your spleen, your intestine received the oxygenated blood only at the time of systolic period. Only at the time of systolic period. What about the heart? What about the
Diastolic period.
when a heart contracts, there will be the pressure on the walls of the heart, and the oxygenated blood and the veins, pulmonary veins, aorta, everything will get emptied because they give the blood to other organs. Okay, there will be pressure on the ventricles, on all the channels. Are you getting my point? All the veins, all the pulmonary veins and the aorta, pulmonary, they will get emptied because they give the oxygenated blood to the other body, to the same body. I mean to say that to different organs. Okay, during diastolic period, these veins get refilled again with the oxygenated blood, and then at that time this heart receives the oxygenated blood, but at the time of diastolic period, because at that time what is happening, these the veins, the arteries, the pulmonary trunk, the pulmonary veins, aorta, during the systolic period they get emptied, but during the diastolic period they get refilled, and during this phase this heart receives the oxygenated blood with the help of coronary circulation. Are you getting my point? So heart receives the oxygenated blood at the time of systolic period or diastolic period?
Diastolic
It receives the blood at the time of diastolic period. But what about the entire body? The body receives the oxygenated blood at the time of systolic period. Thana interesting?
Yes.
Are you getting my point? समझ में आया?